Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be testing on pulmonary embolisms with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 48-year-old postoperative patient suddenly becomes dyspneic, tachypneic, and complains of chest pain. The nurse suspects a pulmonary embolism. What is the nurse's priority intervention? A. Apply sequential compression devices, SCDs. B. Administer prescribed analgesics for chest pain. C. Elevate the head of the bed and apply oxygen. D. Initiate teaching about anticoagulant therapy. Correct answer, C. Rationale: immediate oxygenation and elevating the head of the bed help improve oxygen delivery and reduce hypoxia. Pain management, B, and teaching, D, are important but not the priority. Applying SCDs, A, would not be appropriate during a suspected PE event. Question 2. A nurse is caring for a patient diagnosed with pulmonary embolism receiving a continuous IV heparin infusion. Which finding would require the nurse to immediately contact the healthcare provider? A. Activated partial thromboplastin time, APTT, of 80 seconds. B. Hemoglobin decreased from 13 grams per deciliter to 9 grams per deciliter in 6 hours. C. Platelet count of 170,000. D. Oxygen saturation improving from 90% to 95%. Correct answer, B. Rationale: a significant drop in hemoglobin indicates possible bleeding, a critical complication of anticoagulation therapy. A slightly elevated APTT, A, is expected, and an improving oxygen saturation, D, is a positive finding. Platelet count, C, is within normal range. Question 3. A patient with a massive pulmonary embolism is scheduled for thrombolytic therapy. What action should the nurse take before the infusion begins? A. Assess the patient's mental status. B. Ensure large-bore IV access is established. C. Place the patient in Trendelenburg position. D. Administer protamine sulfate prophylactically. Correct answer, B. Rationale: large-bore IV access ensures rapid delivery of thrombolytics and access for emergency interventions. Trendelenburg positioning, C, is inappropriate for PE. Protamine sulfate, D, is used to reverse heparin, not thrombolytics. Question 4. The nurse notes a sudden drop in end-tidal CO2, EtCO2, from 35 mm of mercury to 20 mm of mercury in a ventilated patient. The patient also becomes hypotensive and tachycardic. What is the nurse's best action? A. Increase the ventilator tidal volume. B. Administer a fluid bolus and notify the provider. C. Suction the endotracheal tube for obstruction. D. Decrease the positive end expiratory pressure, PEEP. Correct answer, B. Rationale: a sudden drop in EtCO2 can indicate pulmonary embolism leading to shock. Administering fluids helps support circulation while waiting for further orders. Suctioning and ventilator changes are inappropriate unless airway obstruction is confirmed. Question 5. A patient newly diagnosed with a pulmonary embolism asks the nurse why heparin is being administered instead of a clot-busting drug. Which explanation is best? A. Heparin immediately dissolves the clot causing the embolism. B. Heparin prevents the clot from getting larger while your body dissolves it naturally. C. Clot-busting drugs are safer than heparin and used for all patients with embolism. D. You do not have a real clot, heparin is just a precaution. Correct answer, B. Rationale: heparin prevents clot extension and allows the body's fibrinolytic system to break down the clot naturally. It does not dissolve clots, A, and clot-busting drugs, thrombolytics, carry a higher bleeding risk and are reserved for massive PE. Question 6. Which assessment finding in a patient receiving anticoagulation therapy for pulmonary embolism would require the nurse's immediate intervention? A. Presence of petechiae on the chest. B. Mild epistaxis during nasal suctioning. C. New onset of hematuria. D. Bruising at venipuncture sites. Correct answer, C. Rationale: hematuria, blood in the urine, is a sign of internal bleeding and needs immediate intervention. Petechiae, mild nosebleeds, and bruising are expected side effects but still monitored closely. Question 7. A nurse is preparing discharge instructions for a patient with a history of pulmonary embolism who will be taking warfarin. What should the nurse emphasize? A. Eat more green leafy vegetables to maintain vitamin K levels. B. Avoid using a soft bristled toothbrush to minimize oral bleeding. C. Limit foods high in potassium to prevent clot formation. D. Notify the healthcare provider before starting new medications. Correct answer, D. Rationale: warfarin interacts with many medications, and the patient must consult the provider before any new prescriptions or over-the-counter drugs. Patients should avoid increasing green vegetables. A. Watch, but do not need to avoid potassium. C. Soft toothbrushes are recommended. B. Question 8. The nurse is assessing a patient with suspected pulmonary embolism. Which clinical manifestation would require immediate notification of the healthcare provider? A. Respiratory rate of 22 breaths per minute. B. Blood pressure of 88/48 mm of mercury. C. Mild pleuritic chest pain. D. Oxygen saturation of 94% on room air. Correct answer, B. Rationale: hypotension is a sign of massive PE causing obstructive shock and requires urgent intervention. Tachypnea and mild hypoxia, A, C, D, are concerning but not as critical as hemodynamic instability. Question 9. A patient with a pulmonary embolism suddenly develops jugular vein distension, JVD, hypotension, and muffled heart sounds. What complication should the nurse suspect? A. Pulmonary hypertension. B. Cardiac tamponade. C. Myocardial infarction. D. Right ventricular failure. Correct answer, B. Rationale: Beck's triad, JVD, hypotension, and muffled heart sounds, suggests cardiac tamponade, a potential complication if embolism causes pressure buildup in the pulmonary circulation. Question 10. A nurse is monitoring a patient with a saddle pulmonary embolism. Which intervention takes priority in the plan of care? A. Prepare for immediate thrombolytic therapy. B. Ambulate the patient to prevent further clotting. C. Restrict fluid intake to minimize pulmonary edema. D. Administer prophylactic low molecular weight heparin. Correct answer, A. Rationale: saddle PE obstructs major pulmonary arteries and is life-threatening. Immediate thrombolysis or surgical embolectomy may be necessary. Ambulation is unsafe at this stage. B. Fluid restriction, C, is not indicated unless specifically ordered. Prophylactic doses, D, are insufficient for existing large embolism. Question 11. A nurse is reviewing laboratory results for a patient diagnosed with pulmonary embolism. Which finding requires the nurse to take immediate action? A. Elevated D-dimer level. B. Platelet count of 90,000. C. International Normalized Ratio, INR, of 2.5. D. Partial pressure of oxygen, PaO2, at 78 mm of mercury. Correct answer, B. Rationale: a platelet count under 100,000 raises concern for heparin-induced thrombocytopenia, HIT, a life-threatening complication requiring immediate intervention. Elevated D-dimer and mild hypoxemia, A, D, are common with PE, and INR of 2.5, C, is therapeutic for warfarin. Question 12. The nurse is caring for a patient diagnosed with PE who is suddenly restless and reports a feeling of impending doom. What is the nurse's best initial action? A. Notify the rapid response team. B. Encourage deep breathing exercises. C. Reassure the patient and continue monitoring. D. Obtain a 12-lead electrocardiogram, ECG. Correct answer, A. Rationale: a feeling of impending doom can signal sudden clinical deterioration with PE, such as worsening hypoxia or right heart failure. Activating rapid response ensures immediate assessment and intervention. Question 13. Which prescription would the nurse question for a patient with a newly diagnosed pulmonary embolism? A. Initiate continuous unfractionated heparin drip. B. Administer morphine IV for chest pain. C. Begin compression stockings on both legs. D. Encourage early ambulation within 4 hours. Correct answer, D. Rationale: early ambulation is appropriate for stable patients receiving anticoagulation. Ambulating a newly diagnosed PE patient without stabilization could worsen the condition. The other interventions are appropriate. Question 14. The nurse is monitoring a patient post-embolectomy for a massive PE. Which assessment finding is most concerning? A. Chest tube drainage of 50 milliliters per hour. B. Heart rate of 120 beats per minute. C. Urine output of 15 milliliters per hour. D. Blood pressure of 110 over 70 millimeters of mercury. Correct answer, C. Rationale: oliguria, urine output less than 30 milliliters per hour, suggests decreased renal perfusion and possible shock. Tachycardia, B, can occur but isn't as critical as evidence of organ hypoperfusion. The other values are within acceptable limits. Question 15. A nurse is teaching a patient starting rivaroxaban, Xarelto, after a pulmonary embolism. Which statement by the patient indicates a need for further education? A. I can stop taking my medication once I feel better. B. I will take the medication at the same time every day. C. I should call the provider if I develop unusual bruising. D. I don't need regular blood tests like when on warfarin. Correct answer, A. Rationale: anticoagulants like rivaroxaban must be continued for the prescribed duration to prevent recurrence. Stopping abruptly increases risk for another PE. Other statements show correct understanding. Question 16. A patient with PE is receiving oxygen therapy. Which finding indicates that the nurse's interventions are effective? A. Patient reports chest pain of 7 out of 10. B. Respiratory rate decreases from 34 to 20 breaths per minute. C. Blood pressure drops to 90 over 60 millimeters of mercury. D. Patient appears increasingly drowsy and lethargic. Correct answer, B. Rationale: a decreased respiratory rate indicates improved oxygenation and reduced respiratory distress. Persistent chest pain, A, hypotension, C, and altered mental status, D, suggest worsening condition. Question 17. The nurse is planning care for a patient at high risk for developing a pulmonary embolism. Which preventive measure should the nurse prioritize? A. Administering aspirin 81 mg daily. B. Encouraging hourly incentive spirometry use. C. Initiating early ambulation postoperatively. D. Placing the patient in prone position twice daily. Correct answer, C. Rationale: early ambulation is the most effective preventive strategy to avoid venous stasis and clot formation, reducing PE risk. Incentive spirometry prevents pneumonia, not PE. Aspirin has limited evidence for PE prevention. Question 18. Which patient is at the highest risk for developing a pulmonary embolism? A. A 20-year-old athlete with an ankle fracture. B. A 72-year-old post-hip replacement patient on bed rest. C. A 40-year-old woman with asthma using corticosteroids. D. A 55-year-old man recovering from pneumonia. Correct answer, B. Rationale: immobility after major orthopedic surgery, especially hip replacement, significantly increases risk for deep vein thrombosis and subsequent PE. Other options present lower risk factors. Question 19. A patient with a confirmed PE has a new order for a vena cava filter placement. What priority teaching point should the nurse include? A. The filter will dissolve the clot in your lung. B. The filter will prevent clots from reaching your lungs. C. You will not need any anticoagulant therapy after placement. D. The filter will improve your oxygen levels immediately. Correct answer, B. Rationale: a vena cava filter prevents additional emboli from traveling to the pulmonary arteries but does not dissolve existing clots or immediately improve oxygenation. Anticoagulation is often continued even after filter placement. Question 20. The nurse is caring for a patient at risk for a pulmonary embolism due to prolonged immobility. Which assessment finding would alert the nurse to early signs of deep vein thrombosis, DVT? A. Diffuse abdominal pain. B. Bilateral ankle edema. C. Unilateral calf swelling and tenderness. D. Decreased pedal pulses bilaterally. Correct answer, C. Rationale: early DVT signs include localized, unilateral, calf swelling, tenderness, and warmth. Bilateral edema, B, is more typical of systemic causes like heart failure. Decreased pulses, D, are not an early sign of DVT. Question 21. A nurse is caring for a patient with suspected PE. Which diagnostic test should the nurse anticipate preparing the patient for to confirm the diagnosis? A. Chest X-ray. B. D-dimer blood test. C. Ventilation perfusion, VQ, scan. D. 12-lead electrocardiogram, ECG. Correct answer, C. Rationale: a VQ scan assesses ventilation and perfusion mismatch, which is highly suggestive of PE. D-dimer is a screening tool. B. Chest X-ray. A. Rules out other conditions but cannot confirm PE, and ECG. D. May show right heart strain but is not diagnostic. Question 22. A nurse is evaluating a patient with a pulmonary embolism who is on a continuous heparin infusion. Which finding suggests the treatment is effective? A. D-dimer levels increase. B. Decrease in chest pain and shortness of breath. C. Presence of blood-tinged sputum. D. Increased calf circumference. Correct answer, B. Rationale: clinical improvement in symptoms indicates effective anticoagulation. Increased D-dimer, A, reflects ongoing clot presence, blood-tinged sputum, C, suggests possible bleeding, and calf swelling, D, may suggest DVT progression. Question 23. Which nursing action best reduces the risk of developing a pulmonary embolism in a hospitalized patient on prolonged bed rest? A. Keeping the legs elevated above heart level at all times. B. Administering low-dose subcutaneous heparin as prescribed. C. Massaging the patient's calves twice daily. D. Applying a warm compress to the lower extremities. Correct answer, B. Rationale: administering prophylactic anticoagulants like heparin is a standard preventive measure. Leg massage, C, could dislodge a clot. Elevation, A, helps with edema but not clot prevention, and warm compresses, D, are inappropriate. Question 24. A nurse is assessing a patient 1 hour after starting thrombolytic therapy for a massive PE. Which finding is most concerning? A. Mild headache. B. Pink-tinged sputum. C. Sudden onset confusion. D. Respiratory rate of 22 breaths per minute. Correct answer, C. Rationale: confusion suggests possible cerebral bleeding, a severe complication of thrombolytic therapy. Mild headache and pink sputum are monitored, but confusion warrants immediate intervention. Question 25. A patient is prescribed enoxaparin, Lovenox, for a PE. Which nursing action is correct when administering this medication? A. Aspirate before injecting. B. Administer into the deltoid muscle. C. Inject into the abdomen, avoiding scars or bruises. D. Massage the site after injection. Correct answer, C. Rationale: enoxaparin should be administered subcutaneously in the abdomen, at least 2 inches from the umbilicus, avoiding scars/bruising. Aspiration and massage are not recommended.
And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 72-year-old patient with a history of CHF is admitted with shortness of breath. A chest X-ray reveals a large left-sided pleural effusion. Which nursing intervention should the nurse prioritize? A. Encourage deep breathing and coughing exercises every hour. B. Elevate the head of the bed to 90 degrees. C. Prepare the patient for a thoracentesis. D. Administer a loop diuretic as prescribed. Correct answer, C. Rationale: preparing the patient for thoracentesis is appropriate because a large effusion causing dyspnea often requires immediate drainage. Deep breathing is useful but not sufficient. Diuretics are helpful in CHF-related effusions, but thoracentesis provides more immediate relief. Question 2. The nurse is caring for a patient who underwent thoracentesis for a pleural effusion. Which post-procedure finding requires immediate action? A. Respiratory rate of 22 breaths per minute. B. Decreased breath sounds on the affected side. C. Pulse oximetry reading of 88% on room air. D. Slight pink tinge drainage from the puncture site. Correct answer, C. Rationale: a drop in oxygen saturation may indicate complications such as pneumothorax. This requires immediate assessment and intervention. Other options are expected or not immediately life-threatening. Question 3. Which of the following assessment findings most strongly suggests that a pleural effusion has become infected? A. Clear, straw-colored pleural fluid. B. Decreased tactile firmness over the affected lung. C. Elevated WBC count and purulent pleural drainage. D. Bilateral crackles on auscultation. Correct answer, C. Rationale: purulent fluid and an elevated WBC count indicate empyema, infected pleural effusion. Other findings may be associated with non-infectious causes or generalized respiratory conditions. Question 4. A patient with a known malignant pleural effusion is experiencing severe dyspnea. Which intervention should the nurse anticipate? A. Teaching incentive spirometry use. B. Administering antibiotics. C. Assisting with chest tube placement. D. Providing humidified oxygen via nasal cannula. Correct answer, C. Rationale: malignant pleural effusions often require chest tube insertion for continuous drainage. Oxygen and spirometry provide supportive care but do not resolve the fluid accumulation. Antibiotics are not first line unless infection is suspected. Question 5. The nurse is evaluating the effectiveness of a thoracentesis for a patient with a moderate pleural effusion. Which finding indicates successful intervention? A. Respiratory rate increases from 18 to 24. B. Oxygen saturation improves from 90% to 96%. C. Decreased breath sounds persist on the affected side. D. Cough becomes more productive. Correct answer, B. Rationale: an improvement in oxygen saturation indicates better lung expansion and gas exchange. An increased respiratory rate may signal distress, and persistent decreased breath sounds may mean incomplete lung re-expansion. Question 6. A patient undergoing treatment for pleural effusion develops tracheal deviation to the right. Which is the nurse's priority action? A. Notify the healthcare provider immediately. B. Encourage the patient to cough forcefully. C. Reassess breath sounds in 15 minutes. D. Document the findings and continue monitoring. Correct answer, A. Rationale: tracheal deviation suggests a tension pneumothorax, a medical emergency. Immediate provider notification is required for life-saving interventions such as needle decompression. Question 7. Which finding should the nurse report immediately during chest tube drainage of a pleural effusion? A. 50 milliliters of serous drainage in 1 hour. B. Fluctuation of fluid level in the water seal chamber. C. Sudden onset of severe chest pain and dyspnea. D. Absence of continuous bubbling in the suction control chamber. Correct answer, C. Rationale: severe chest pain and dyspnea during chest tube drainage may indicate re-expansion pulmonary edema or pneumothorax. This requires immediate medical evaluation. The other findings are expected or benign. Question 8. Which patient is at the highest risk for developing a pleural effusion? A. A 28-year-old with asthma. B. A 60-year-old with pneumonia and uncontrolled diabetes. C. A 55-year-old with a history of seasonal allergies. D. A 34-year-old postoperative cholecystectomy patient. Correct answer, B. Rationale: pneumonia, especially with immunosuppression like diabetes, increases the risk of parapneumonic effusions. Asthma and allergies affect airways, not the pleural space. Postoperative patients may develop effusion but are at lower risk. Question 9. Which nursing assessment finding best indicates that a patient with a pleural effusion may need urgent thoracentesis? A. Audible wheezing on auscultation. B. Persistent dry cough. C. Use of accessory muscles during respiration. D. Mild fatigue and malaise. Correct answer, C. Rationale: use of accessory muscles indicates increased work of breathing and possible respiratory distress, necessitating intervention to relieve pressure from fluid accumulation. Question 10. A nurse is providing discharge teaching to a patient treated for recurrent pleural effusion with a pleurodesis. Which statement by the patient indicates a need for further teaching? A. I'll contact my provider if I have shortness of breath. B. It's normal to have some mild discomfort for a few days. C. The fluid will be absorbed over time without draining. D. I should avoid deep breathing to prevent pain. Correct answer, D. Rationale: deep breathing is encouraged after pleurodesis to prevent atelectasis and promote lung expansion. Avoiding it can lead to complications. The other statements are appropriate. Question 11. A nurse is caring for a patient diagnosed with transitive pleural effusion. Which underlying condition is most likely the cause? A. Bacterial pneumonia. B. Lung malignancy. C. Congestive heart failure. D. Tuberculosis. Correct answer, C. Rationale: transitive effusions are typically caused by systemic factors like CHF due to increased hydrostatic pressure. Exudative effusions are caused by local factors like infection, malignancy, or inflammation. Question 12. The nurse is preparing a patient for a scheduled thoracentesis. Which nursing action is most appropriate before the procedure? A. Instruct the patient to lie flat for 30 minutes. B. Position the patient in the high Fowler's position, leaning forward. C. Administer a full meal to prevent vasovagal reaction. D. Encourage incentive spirometry to expand the lungs. Correct answer, B. Rationale: the patient should be in a seated, upright position leaning forward over a bedside table to allow access to the posterior pleural space. Lying flat and eating a meal are contraindicated before the procedure. Question 13. A nurse reviews a pleural fluid analysis report for a patient. Which lab result supports the diagnosis of exudative pleural effusion? A. Pleural fluid protein serum protein ratio of 0.2. B. Glucose level in pleural fluid equal to serum glucose. C. Pleural fluid LDH higher than 2/3 the upper normal serum limit. D. Clear, straw-colored pleural fluid. Correct answer, C. Rationale: exudative effusions meet Light's criteria, including high LDH levels. A protein ratio less than 0.5 and glucose equal to serum suggests transitive fluid. Question 14. The nurse is monitoring a patient for complications after thoracentesis. Which finding is most concerning? A. Decreased blood pressure. B. Mild pleuritic chest pain. C. Small amount of serosanguinous fluid at the puncture site. D. Decreased breath sounds over the affected lung. Correct answer, A. Rationale: hypotension after thoracentesis may indicate fluid shift or hemorrhage, which requires immediate attention. Mild pain and decreased breath sounds can be expected post-procedure. Question 15. Which assessment would most likely differentiate pleural effusion from pulmonary edema? A. Fine inspiratory crackles. B. Decreased chest expansion on one side. C. Frothy sputum production. D. Elevated jugular venous pressure. Correct answer, B. Rationale: pleural effusion often causes unilateral findings like decreased expansion and dullness to percussion. Crackles and frothy sputum are typical of pulmonary edema. Question 16. The nurse is educating a patient about recurrent pleural effusion due to cancer. The provider recommends an indwelling pleural catheter. Which statement by the patient requires correction? A. I can drain the fluid at home with guidance. B. This device reduces the need for repeated procedures. C. Once inserted, I should avoid all physical activity. D. A nurse may help me manage the catheter at home. Correct answer, C. Rationale: patients can typically resume normal activities with some limitations. Complete avoidance of activity is not necessary. The other statements reflect accurate understanding. Question 17. Which finding would the nurse expect during auscultation of a patient with a large pleural effusion? A. Rhonchi throughout all lung fields. B. Egophony over the effusion. C. Increased tactile fremitus over the effusion. D. High-pitched wheezing on inspiration. Correct answer, B. Rationale: egophony, increased resonance of voice sounds, can occur above the level of an effusion. Tactile fremitus is decreased, and rhonchi or wheezing are not typical. Question 18. Which assessment data best supports the nursing diagnosis of impaired gas exchange in a patient with pleural effusion? A. Anxiety and restlessness. B. Pleural friction rub. C. SpO2 of 89% on 2 liters by nasal cannula. D. Decreased breath sounds in the right lower lobe. Correct answer, C. Rationale: low oxygen saturation confirms impaired gas exchange. Other signs may be present but are nonspecific or less directly linked to gas exchange effectiveness. Question 19. The provider orders a thoracentesis for a patient with a right-sided pleural effusion. What is the most appropriate instruction by the nurse during the procedure? A. Take slow, deep breaths while the needle is inserted. B. Hold your breath when I say go. C. Remain completely still and avoid coughing. D. Lie back and relax while the fluid is removed. Correct answer, C. Rationale: sudden movement or coughing can cause needle displacement or injury during thoracentesis. Patients are typically told to stay still and may be asked to suspend breathing momentarily. Question 20. Which of the following is a priority nursing goal for a patient with a large pleural effusion awaiting thoracentesis? A. Promote mobility and ambulation. B. Prevent development of atelectasis. C. Improve oxygenation and relieve dyspnea. D. Reduce the risk of pulmonary embolism. Correct answer, C. Rationale: the priority in pleural effusion is to relieve respiratory distress and hypoxia. Preventing atelectasis is also important, but immediate improvement in oxygenation takes precedence. Question 21. A nurse is caring for a patient with a moderate right-sided pleural effusion. Which physical assessment finding is the nurse most likely to document? A. Hyperresonance to percussion on the right. B. Increased breath sounds in the right base. C. Dullness to percussion over the right lower lobe. D. Inspiratory stridor throughout the lung fields. Correct answer, C. Rationale: pleural effusion causes dullness to percussion over the area where fluid has accumulated. Hyperresonance is found with pneumothorax. Stridor is an upper airway issue and not typical of effusion. Question 22. The nurse is reviewing orders for a patient with a large pleural effusion. Which order should the nurse question? A. Position patient in high Fowler's. B. Incentive spirometry every 2 hours. C. NPO after midnight for thoracentesis. D. Ambulate patient 3 times daily. Correct answer, D. Rationale: patients with large pleural effusions often have significant respiratory compromise, making ambulation unsafe until after fluid removal. High Fowlers and spirometry promote lung expansion, and NPO is appropriate pre-procedure. Question 23. Which of the following is a potential complication of untreated pleural effusion that the nurse should monitor for? A. Myocardial infarction. B. Lung abscess. C. Atelectasis. D. Pulmonary embolism. Correct answer, C. Rationale: accumulated fluid can compress lung tissue, leading to atelectasis. Pulmonary embolism and MI are not directly caused by pleural effusion. A lung abscess is more common in pneumonia. Question 24. A patient with a history of liver cirrhosis presents with dyspnea. Ultrasound confirms pleural effusion. The nurse anticipates which type of pleural fluid. A. Hemorrhagic fluid. B. Milky chyle fluid. C. Transitive, straw-colored fluid. D. Foul-smelling purulent fluid. Correct answer, C. Rationale: cirrhosis leads to transitive pleural effusions due to low oncotic pressure from hypoalbuminemia. Hemorrhagic or purulent fluid would suggest infection or malignancy. Question 25. A patient is recovering from thoracentesis. Which finding is most essential to report to the healthcare provider? A. Patient reports mild soreness at the site. B. Sudden increase in respiratory rate and chest pain. C. Slight drainage noted on the dressing. D. Pulse oximeter reading of 94% on room air. Correct answer, B. Rationale: a sudden increase in respiratory rate and chest pain post-thoracentesis suggests a possible pneumothorax or re-expansion pulmonary edema and needs immediate evaluation.